Naona kama iko wazazi hapa pia. Wazazi hamjambo. Karibuni sana Wizara ya Afya. Lakini mmekula ama hamjakula? Mmekula kabisa? Basi Mungu asifiwe.
You are the only one that truly loved me, the only one that cared. You are the only one that understood me. So where do I go from here? Hallelujah. Haunipendi, oh, nitafanyeje? Oh, haunipendi. Mpenzi wangu wa miaka nyingi, kupitia yote tuliyopitia, siwezi.
This is but a beginning. We have started with the nurses, and hopefully in the near future we'll get the other cadres also going to be able to serve in various parts of the world. So with those few remarks, allow me to invite the chair of KMTC Board of Directors, Ambassador Zakari Muri Mwita, to make his remarks.
We are proud to note that we remain a major exporter of health workforce. The college has repositioned its strategy in line with the health training needs. I am happy to report that even as we expand, we continue to concentrate on quality.
Chief guest, CS Honorable Mutahi Kagwe, British High Commissioner, Miss Jane Marriott, distinguished guests, all protocols observed. It is indeed a pleasure to be here this afternoon to celebrate and recognize the key achievements that we've had towards the UK-Kenya bilateral agreement. I think you all agree this is a testament to the quality of education that we give in this country, particularly for nurses and midwives. And as Nursing Council, we are wholly supportive of this process. But today it's not about us, today is about you, those who are going. So at this point, I would like you to bear with me, Bwana Waziri. We listen briefly to an experience of this process from Lois Kwamboka. Lois?
The Chief Guest, the Cabinet Secretary, Minister of Health, Honorable Mutahi Kagwe, the Principal Secretary, Susan Mochache, the British High Commissioner, Jane Marriott, the Chairperson, Nursing Council of Kenya, Professor Eunice Ndiragu, the Chairperson of KMTC, Mr. Zakari Mburi, and the Director General, Ministry of Health, Mr. Patrick Amo. All protocol observed, good afternoon. On behalf of the Pioneer team to successfully transition to the UK via the bilateral agreement between the UK and the Kenyan government, and the entire nursing fraternity, hereby extend a very hearty vote of thanks to all stakeholders for being here today to grace this unique occasion. We thank you that you have worked tirelessly and are still working with us to make sure that our relocation is comfortable and very easy.
Your Excellency, it is now my honor and pleasure to invite you to be able to make your address.
Thank you very much indeed. There are a long list of guests of honour and important people here today, including, of course, our very own CS for Health, Mr. Kagwe, Senator Kagwe. But actually, I'd like to turn my attention to you, the amazing 19 nurses, which is why we're here today. And I wondered if you could all just sort of stand up one by one, going around the table and tell us where you're from. So, Jane from London. Perhaps, Lois, we could start with you. Thank you so much, and it's great to see so many nurses from across the whole of Kenya, but secondly also to see so many male nurses. I think in the UK we don't have enough male nurses, and we need more male role models and more nurses. So thank you for trailblazing and leading the way, including within our own National Health Service.
My friend, the British High Commissioner to Kenya, Her Excellency Jane Marriott, invited guests, members of the Fourth Estate, good afternoon. Today I am similarly excited because it's been a long time coming for me. It's been one of the things that I've always wanted to see. This is an afternoon I've waited for a while. And therefore it is with enormous joy and personal satisfaction that I stand here today to flag off the first cohort of Kenyan nurses to the UK following the bilateral agreement between Kenya and the UK. These matters need diligence, and I take this opportunity to thank and congratulate all those working to ensure our young men and women can find meaningful employment in the United Kingdom and elsewhere as nurses. So this program is expected to benefit many families and contribute to the growth of our economy from the income that our healthcare ambassadors will be sending back home in terms of capital and investments. So, yani ni kusema na njia fupi, ukipata mali sio tu ya mambo ingine, ya kutuma nyumbani na mambo kama hayo na kujisaidia. Si mnaelewa? Kwanza hii vijana mnajua nasema nini Haya.